Hi, Professor Wagner. This is my presentation for my clinical reflection for leadership. The first slide is just all the clinical objectives that were needed to be met for this class. Objectives 1, 2, and 3 were met by every single clinical experience that I had. For example, number 1, I always had to use my previous knowledge to understand what was going on in the clinicals, how to portray information, and have the ability to teach others about what I already know. Objective number 2, basic principles of management to meet the challenge of an ever-changing healthcare environment. That's just every single day. You come into something different. You never know what you're going to walk into. A patient could be stable and then crash the next minute, so you really have to be flexible. And then objective 3, communication through the self and the College of Nursing professional manner. Leadership is all about showing that you can be a leader, that you are an independent person, and that you don't have to rely on someone else for your actions. So my advanced practice nurse, I shadowed the director of the Reading Hospital McGlynn Cancer Institute. My day was pretty boring. She wasn't out on the floor too often. We sat in her office pretty much the whole 8 hours. That day, the person that was in charge of staffing and scheduling was in the ER because they were feeling sick. So she had to do her job on top of that role. So in the morning when I first got there, she was doing payroll. She had to make sure that the hours matched up, that no one had overtime hours. Someone came in and gave her the results of the readiness rounds, which is basically an internal hospital checklist where they go around and see everything's in place to be prepared for when the Joint Commission comes or the Department of Health, and she has to address all the issues that were listed to make sure they are up to par and in code for when they do come and get audited. And then again, she was in charge of staffing for the next day at work, what nurses are going to take the patients. This was a lot more complex because some patients had longer transfusion time. Some of them needed education, which she said takes very long. So it was mostly desk work. She did go out on the floor just to help disconnect some tubing, but that wasn't for very long. So the director is definitely a desk job and less so a clinical position, which I'm not sure that I would really enjoy. I like to be on the floor and doing things rather than sitting down all day. My nursing supervisor shift, I really enjoyed. I did the evening shift, 3 to 11 at Cedar Crest. At first, I shadowed 2 nurse supervisors that were both named Heather. The first one, she was doing staffing for the night, seeing how many people were on each unit, what it was looking like in the ED, to know where to place staff for that night and how it would need to look for the night shift coming in. They would like to round on the room, all the units that they're assigned, which is pretty much all of them in the hospital, at least twice during the day. Pretty much they just go check in, see if there's any problems going on they need to help with, if there's any staffing issues, anything going on, which is really nice. And I think the nurses appreciated that. And then I actually got to see a code blue, which was really exciting for me. Normally when big stuff happens, they're always kicking nursing students out of the room, and she was like, go in there, see what's going on. So that was really interesting. And then it was more so the residents that were not in the room, which was interesting. So I really enjoyed this experience. I don't know if it's necessarily the right position for me either. The staffing was pretty awful. They had about like 30 1-to-1s and not enough people to place them, and then units were getting mad. They were taking their tech partners. So I don't know if I could really deal with that part of the job, but I did enjoy like the rounding and going to all the code blues and RRTs. The political and legislative day is when we went to Harrisburg. That addressed objectives 1, 2, and 3, along as objective 5. And that was more so due to the lobbying that we did, which was very minimal. But it was also because we got to speak to people who can actually make change happen, whether it be someone in the House or in Congress, which was pretty cool. Unfortunately, that day they were not in session, so there were very few lawmakers in the building, so it took us a long time to find people to go and see. But we did find Representative Hershey, who was willing to talk very briefly. He was very new to the role. He was young, so he didn't really seem like he wanted to talk, but he put on face, and he kind of was just like, yeah, I'm a part of a healthcare board. I really should like learn more on this stuff. And then also Objective 7 relates to this one as well. One of the congresswomen, she was a previous nurse, and she spoke about how she's pushing forward many bills for nurses, specifically how nurse practitioners, after a certain amount of years, are able to practice independently, which I thought was really cool that she is sticking up for us. And then the Code of Ethics, Provision 8, where nurses work with others to protect human rights, promote health diplomacy, and reduce health disparities. That's through laws and bills that need to be passed to make sure that everyone gets the healthcare that they need and at an affordable cost. Community leadership. I did both Lehigh County Prison and community blood pressures with you. This did objectives 1, 2, 3, along as 5 for a patient advocate, nurse advocate, and change agent. In the prison, you know, the inmates don't have anyone to advocate for themselves. They don't really have any rights in prison, so it's really up to those nurses to say, yeah, you need to go seek treatment, if it's needed, whereas the correctional officers probably wouldn't give them that, respect. And then Objective 6, personal leadership and growth, and a contributing member of society. This is just going out in the community, you know, doing your part, giving back to the community and making sure that people that need help are getting the help. And then Provision 1 in the Code of Ethics, nurses practice with compassion and respect for each person. Just because someone doesn't have something that you have, or they're in a lower socioeconomic class, they still deserve the respect and dignity that someone in a higher class would get as well. Healthcare should be universal, and everyone should have access to it if they need it. Service leadership, I did it at the Da Vinci Science Center. Again, it hit objectives 1, 2, and 3. As well as Objective 6 for continued personal growth and a member of society. I really love volunteering and being a part of something bigger than myself. It's always nice to give back and help out when you can, even just in little ways, like going to the Science Center and helping out with staffing, doing little expos where they train me and I lead that so that the higher-ups can do the desk work that needs to get done. Unfortunately, the Science Center, the times that I went, it was pretty dead. So there wasn't a lot going on. But I just tried to make do by tidying up and making sure that everything was in place in case people did come in. My interprofessional hours were done at Luther Crest. I shadowed an occupational therapy assistant. This was not the best experience for me. They weren't prepared for someone coming. I was waiting a long time until they put me with someone. And then this woman more so thought that I was like there to help her rather than like see what she did. But this hit objectives 5 and 8. 5, a nurse advocate, especially in this kind of setting. You need to be an advocate for the patient. A lot of the times the patients are unable to do anything for themselves. So you really have to be the person to stick up for them and say, okay, I'm going to take the time to do this and make sure they get this kind of care done. Unfortunately, a lot of negligence does happen. The nurses just don't have the time or the staffing to give each patient the care that they really deserve, which is sad. But it's on them to make sure that the necessary stuff is getting done. And then objective 8, ethical dilemmas. Again, this goes back to the problem where there's not enough staffing, there's not enough time to adequately take care of each patient. But you need to do your best to make sure to treat patients and residents with respect and dignity. And unfortunately, it doesn't happen all the time. You hear of elder abuse in the communities where older people are being hit or abused, and that's just not okay. Continuing education, I did most of my hours for the Center for Humanistic Change, and we learned about fetal alcohol spectrum disorder. This hit one of our objectives 6 for, again, personal development and growth. It's important because more education leads to more knowledge and personal growth in your area or an area you're not super well educated on. And you have the ability to learn new information and apply it to practice. This applies to provision 5, the continuation of personal growth. Again, you always want to make yourself better, the best nurse you can be. And then it's necessary for nurses to improve their knowledge or skills to promote professional development and enhance their contribution to healthcare. Again, just being a well-rounded nurse, maybe learning something that you didn't know previously. Peer leadership, I did both 320 and 321 skills recording. I did have a lot of people show up to these actually, which is really nice. And they were very appreciative of my help. A lot of the times it was more so sterile procedure or setting up their tables where they really needed the work rather than the skills. The 309 first prep. For some reason, they went very early in the day, so when I got there, they said half the class was already finished, and then the second half was about to be finished, but I tried to give them tips. I told them it definitely should not take them 5-6 hours, and gave them tips to fix it. And I did 313 and 320 sim as well. This does objectives 5 and 6. Patient advocate told the students that you really need to stick up for your patients. You know what's best. You're the one that's there with them. And then I was the leader for all of these experiences. I was the main resource for students. So I really had to know what I was doing to ensure that they would succeed just like I did. My independent experiences, we did the Dine and Discuss. I did the flu clinic, which I really enjoyed. It's nice because you don't always get to give a lot of injections in the hospital. I do wish that I got to do it somewhere in a larger area rather than at school. But it was still a good experience. Blood pressures, we did not have many people come to that. And then the Lehigh County Prison again for just some extra hours that rolled over. And then this goes with provision 4. A nurse has authority, accountability, and responsibility for nursing practice. You're an independent person. You're responsible for your actions. And then my last one was patient logistics. I did that today. So the day before this was due. And I saw how they deal with people who die and where they go in the morgue. Muhlenberg only has 2 adult spots. So they might have to transfer them to Cedar Crest. I saw how Citronia deals with the EMS and patient transport between hospitals or home or other places. And then also how they deal with bed management and putting patients in places. Unfortunately, a lot of the time they are stuck waiting in the emergency room just because right now at this time there's so many people sick and there's no beds in the hospital. And then post-conference and research dissemination, that will cover objective 4. Related to research and evaluating articles. It will be my article being presented at a post-conference, which I do not have yet, but I will present the findings and promote class discussion. And then provision 7, profession through scholarly inquiry and research. Just staying up to date on new practices and how to implement it into your practice. And these are my references. Thank you for watching.